Chest tube meds are kind of a new thing for me too. And so let's talk about it. One of the reasons you may need a chest tube is you have a fluid collection in your pleural space. And sometimes that pleural infection can be called an empyema, aka pus in chest. Typically in the past, if we put a chest tube in and drain this and it wasn't getting better, patients would actually require surgery in order to clear up and remove this infection. Lately, we've actually been instilling TPA, Dornase, and saline in that order, TPA, Dornase, and saline into the pleural space, clamping the chest tube for a prescribed amount of time to help kind of break up that infection that's in there and help it drain out better. This was a study that was recently done, and they actually found that by instilling the TPA, the Dornase, it cured over 90% of patients without requiring surgery. Kind of interesting. And I will say I've only had to do this a handful of times. It is newer. We just got trained on it within the last year at my hospital. We learned that you can give these meds in alphabetical order. So TPA, alteplase is the other name. So A, Dornase, and then saline, ADS. Clamp the chest tube. You can clean it off with an alcohol swab at the little port if you have a port. If not, then the chest tube tubing is self-healing, meaning if you stick it with a needle and you pull that needle out, that tubing should kind of clot off or occlude back off and not have an actual hole in it. You instill the meds, keep the chest tube clamped for whatever amount of time, typically an hour, but I've seen like up to 3 hours. And then afterwards you unclamp it and let that fluid drain out. It's kind of uncomfortable for patients because typically the meds that you're instilling, it's quite a bit of volume, about like 50 milliliters or so per syringe. So TPA, Dornase, and saline. And so it's quite a bit that goes in there and can be uncomfortable for the patient. But that's the only meds I've seen instilled. So if you've seen something else, I am curious, let me know.